Hello, I'm Dr. Rob Lindsay, Vallejo Health and Wellness Center, and today this video is about heart disease. We're calling it the Heart Disease Recovery Workshop. And the subtitle, What Your Doctor May Not Be Telling You About Heart Health. We're going to go through some different things that I think are going to be very interesting for you. There's going to be some good information you can take and apply to your life. But in the end, information is just information. If you don't choose to do something with it, then you've wasted time. Please don't waste time. Please get out a piece of paper. Please take some notes here, because when you're engaged and active and participating in your health, that's when you can make life changes. So I hope and pray that you can do that now. And we're going to get started right now here. And I've got, just start with a testimonial. A man named Paul. And this is what he wrote. He said after 2 weeks, he lost 17 pounds. And he noticed that he had no more acid reflux, his joint pain was gone, his energy was back, and his blood pressure had dropped to normal after being high for 20 years. Now, something that he said, though, was this: we know this is going to be a lifestyle change, but the changes are well worth the health benefits we have gained and want to maintain. So, if you don't want to maintain or change your life and change if you have this heart disease or someone you know has heart disease, then really, why bother? Okay? Why do you want to change? I think you need to ask yourself that question. Why do you want to have your heart working better? Is it simply so that you can move through life? Or is it because you actually care about something else in your life? You have a bigger purpose and meaning. So I challenge you to look for that, okay, as we go forward. Now, who am I? Well, I'm Dr. Rob Lindsay. I'm a chiropractor by trade, a doctor of chiropractic. I have a master's degree in sports medicine. I have been involved in functional endocrinology, functional blood chemistry analysis, and functional neurology for the last several years. And I study and train around the country with about 400 different doctors who also study the same way and work with patients the same way I do. And it really is about getting to the root cause. That's what we do. We're not about treatment with drugs. We're about getting to the cause. So here's something that I think is really important for you to think about is average life expectancy. I thought this was interesting. Now in America, the average life expectancy from birth until death is about 78 years. Now, you think about that for a second. 78 years isn't that long. And if you take that and apply it to how many weekends, then you're talking about 4,056 weekends. Well, I think that was really interesting, because 4,056, we all live for the weekend, it seems like. So I thought, hey, let's find out how many weekends I have left, okay? Because the decisions that you make from this moment forward, just like the decision I make going forward from here, is going to determine how long you have. Decisions start right now. It's going to determine whether you go back and have less life, or you go forward and up and have more life. Now, I'm 44, and if I do like everybody else, what I determined was, with a calculator, was that I determined that I have about 34 years left in life. Well, how many weekends is that? I found out that it's only 1,768 weekends. That's not very much. Okay, I've got 4 young boys. I want to be there for them. I want to be in maximum health. And I hope and pray that you want that too, and that's why you're watching this video, because if you follow the different things that we tell you here, and you learn this stuff, and then get the right person to check you out, your life can be changed. All right? How many weekends do you have left? Think about that. Now, what I want you to do with your piece of paper is I want you to draw a little circle in the middle, and in the middle of that circle, we're going to write something in just a moment. But before we do, what I want you to do on the top of your page is I want you to write web of physiologic dysfunction, because this is what you have. If you have heart disease, I want you to know right now that it is a physiologic impossibility for you just to have heart disease. It's impossible. In order for you to have heart disease, you have to have multiple organ systems that aren't working good, and it's called a web of physiologic dysfunction, and my job is to untangle that web. So this is what your web looks like. And you can put heart disease right in the middle of your paper, and then out from that, if you look, you'll see that there are all these things that contribute. We've got blood sugar imbalances. We've got adrenal dysfunction. We've got mind and body issues, cell dysfunction, brain and neurotransmitter dysfunction. immune system problems. We've got thyroid and gut function problems. So you have to find somebody who's willing to look into all these areas that's going to help you. So you have a web of physiologic dysfunction. Now, I want to go through a whole bunch of information. I want to dispel some of the myths that are out there that we've all heard growing up. Can you handle the truth? All right? Can you handle the truth that cholesterol is not a primary risk factor for cardiovascular disease? Elevated serum cholesterol is not a cause of heart disease and strokes. It's not. Eating foods high in cholesterol is not a cause of elevated blood cholesterol. Okay? And eating high cholesterol foods is not a cause of heart attacks and strokes. And in fact, high cholesterol and saturated fatty foods, they actually keep your serum cholesterol down to normal levels. So, do you remember when you heard from people, oh, you can't eat eggs, they're too high in cholesterol. Or cut back on your meat, too high in cholesterol. You got to cut back on your cholesterol levels. Well, not true. Absolutely not true. Excuse me. Okay, so as I was saying, high cholesterol and saturated fatty foods actually keep your blood cholesterol levels down. So you should eat meat. You should eat eggs and poultry. And you may go, what? What are you talking about? Right? Half the people in the world have been marching with this cholesterol crusade for decades. Why should I believe you? Well, it starts with greed, okay? As many things in our society does, the almighty dollar goes first. Damn the truth, safety, and efficacy, okay? Now, in the 1960s, cholesterol really was ignored until it was over about 300 in the body. 300. Then something happened. What happened? Archer Daniels Midland Company, all right? You've heard of this company. See, they wanted to sell an ocean of soybean oil. So they led a charge against cholesterol and against saturated fat. They led this charge saying, oh, this stuff is horrible for you. You can't eat this you need to eat soybean oil. All right? So then what happened was coconut and palm oils were actually banned from being imported. We now know that coconut and palm oils are some of the safest, most healthy oils on the planet. They have anti-infective properties. They're amazing for your health. Margarine was going to save our nation from an epidemic of cardiovascular disease from eating the dreaded saturated fat. Okay? Where's margarine now? Horrible for you. We now know that margarine is one of the worst things you can put in your body. So it really was about billions of dollars of propaganda. And it swayed the minds and lifestyles of millions of Americans. But the medical pharmaceutical establishment continued to largely ignore this perceived cholesterol threat. So then what happened? Well, what happened was statin drugs were invented. That's what happened. Okay? Now, predictably, a paradigm shift in the establishment accompanied these drugs. See, now, cholesterol was the demon of the century, and our doctors and pharmacists were going to exorcise the evil that lurked within all of us, okay, from ill-advised intake of meat and eggs. They were going to stop that. We got a drug, we got to use it. So the all-out war against cholesterol has been waged for over 25 years now, and it has not waned at all, despite the fact that for at least 5 years, it has been known that cholesterol is not, and it never has been, and never will be, a primary risk factor for cardiovascular disease. Wow, that's a big statement, right? Well, let's talk about some of the dangers of these statin drugs, all right? They cause liver damage. Statins block some enzyme. It's called HMG-CoA reductase. So now the liver just can't make cholesterol. In a minute, you'll find out that that's not a good thing. See, you need to check your liver enzymes every 6 months if you're on a statin drug because it causes liver enzymes to go through the roof. That's a sign of liver disease. The truth is, your liver produces about 2,000 milligrams of cholesterol every day. And if your liver is trying to do you think that your liver is trying to destroy you with cardiovascular disease? No. The liver is wisely making cholesterol. Wisely. This is preposterous to think this way because cholesterol is an essential nutrient with many, many critical functions. And statin drugs interfere with normal liver metabolism. They inhibit liver production of substances for health, and they damage your liver. How about some more dangers of statins? Okay, musculoskeletal pain is one of the issues. It can be severe. It's frequently misdiagnosed as chronic fatigue or chronic pain syndrome. It's like fibromyalgia. You're often given a diagnosis of tendonitis or bursitis or a rotator cuff problem when the statin is the cause. People are given surgeries to repair a rotator cuff that didn't need it, all because the statin drug was causing the pain. And it can cause this muscle issue called myopathy that can lead to dying, necrosis of the muscles. Then that causes an overload of the kidneys. It leads to kidney failure, and you can actually die from this. These are serious drugs, folks. So, are you still convinced that cholesterol is a bad guy? Well, look at this. People with low serum cholesterol and less than 180 have 3 times the incidence of stroke as the general population. Here's a quote this is from the former director of the Framingham Heart Study. This guy is nothing to sneeze at. He's a medical doctor. He said people with low cholesterol, lower than 200, suffer nearly 40% of all heart attacks. This is from the Journal of the American Medical Association in 1997. This goes back a ways. The more saturated fat you eat, the less likely you are to suffer a stroke. Wait, I thought we were told saturated fat was not good for you. It makes me go, right? They found that polyunsaturated fats, the ones that they tell us are good for us, have no protective effect. They don't protect you, but your risk of stroke decreases by 15% for every 3% increase in saturated fat. In other words, the more saturated fats you eat, again, they told us they were bad, but the more saturated fats you eat, like from eggs and fish and meat, your risk of stroke decreases. That seems like a good thing to me, right? So what's the number one risk factor for cardiovascular disease then? It's this. It's your ratio of triglycerides to HDL cholesterol. Remember HDL, high-density lipoprotein? That's considered your good cholesterol. And I want you to know something. In reality, there's no good and there's no bad. They've made LDL cholesterol to be the bad guy. It's not bad. It's there. God made it, and He put it inside of you for a reason. It's just that when LDL cholesterol gets to a certain level, then it can become damaging. But this is important, the ratio of triglycerides to HDL cholesterol. In other words, you want to have high HDL cholesterol and low triglycerides so that your ratio is better. See, is this a hard pill for you to swallow? To hear this information? Remember, you've been exposed to millions of dollars of anti-fat, anti-cholesterol propaganda over decades of time. Over decades. And these are the lies of the seed oil industry. Margarine, mayonnaise, cooking oil, salad dressings, anything from corn oil, soy oil, safflower oil, canola oil, peanut oil, or vegetable oils, anything except really olive, coconut, and palm, okay? These accelerate aging. They break down the body. It's called catabolic effect. And they cause oxidative damage in blood vessel walls and in the heart, which precipitates cardiovascular disease. So when you eat these things that they told us are good for us, you are actually accelerating your own cardiovascular issues. Okay? They damage your blood vessel walls. Here's the Journal of Lipid Research from 2000. They showed that eating vegetable oils from soy or margarine raised LDL and lowered HDL. Meanwhile, eating butter, which they said is forbidden, right? Because it's got saturated fat and cholesterol. But eating butter actually lowered LDL and increased HDL. Seems like you maybe want to have some butter. And you would die without cholesterol because your brain is made of cholesterol. 5% of the dry weight of your brain is made of cholesterol. Your nerves are made of cholesterol. Your body uses cholesterol to make all of your important sex hormones and your adrenal hormones. Cholesterol is the backbone for this. We see people in our office who have their cholesterol is too low, and no wonder that their hormones are a mess because they can't make any. Without cholesterol to help your digestion, you couldn't absorb any of your fat-soluble vitamins like A, D, E, and K. You wouldn't be able to absorb them. So we have people, right, who've gone to the doctor. The doctor said, wow, you've got low vitamin D. What do? They give them a vitamin D supplement. Meanwhile, they're on a statin drug because their cholesterol was up high. And the statin drug is keeping their cholesterol low, so now they can't even absorb the vitamin D they're taking, and they wonder why they're chronically sick. Do you see the problem and the madness behind this? It drives me crazy. And every single cell in your body is surrounded by a membrane that contains cholesterol, and that without that cholesterol membrane in your body, you could not function. So, do you still think cholesterol is a bad guy? You would die without it. Cholesterol is so important that your liver produces 2,000 milligrams a day, right? And when following a low cholesterol diet, your liver makes up the difference by producing more cholesterol just to be sure you have enough. So, high cholesterol in the blood doesn't come from eating foods with high cholesterol. It comes from a metabolism that's not efficient at handling the cholesterol you need. It goes back to the web of physiologic dysfunction that we talked about. That's what you're suffering from if you have heart disease. So then what is one of the primary causes of heart attacks and strokes? It's triglycerides. Okay, this is a blood fat. That is the primary risk factor that increases your chance of having a heart attack or stroke. And even though triglycerides are a fat, the unhealthy diet that raises triglycerides has nothing to do with fat intake. Triglycerides and cholesterol as well are elevated by eating sugar. That's the problem. Eating sugar elevates triglycerides. The other dietary factor that in some cases will raise cholesterol are these polyunsaturated oils. Okay? These are the ones that the propaganda says will help prevent cardiovascular disease. It's the complete opposite. It almost seems like a conspiracy, doesn't it? Yeah. So, neither triglycerides nor cholesterol are elevated by eating saturated fat in general or high cholesterol foods in particular. Remember, while cholesterol is not a primary factor for cardiovascular disease, triglycerides are, and they're probably the most significant. So a study published in the journal Circulation shows the result of a Harvard research that indicated that the 25% of the population with the highest triglyceride to HDL ratio has 16 times more heart-related events than the 25% whose ratios were the lowest. So if I was you, I would go to my lab work and I would look at my triglyceride level and I would divide it by my high HDL level. And if that is above 2, then boy, it is time to do something different. It is time to change, because you're in trouble if you keep letting it go that way. Not because of cholesterol, because of triglycerides. And I have seen from countless other studies, high triglycerides come from excess starch and sugars in the diet. Starch and sugars. So, if it is triglycerides and not cholesterol that is the true boogeyman, what weapons do you have to defeat this villainous foe? What are your weapons? Start with a fundamental diet, right? You'll be halfway there. We can talk specifics if you come into the office. You need to eliminate sweetened beverages, including juice, along with getting rid of really breads and cereals and pastas, not to mention, of course, cakes and cookies and pies, ice cream, and all these processed foods. Okay? If you do that, you will see a significant improvement in your triglycerides. So, here's 4 dietary rules to beat heart disease. Number 1, eat 3 meals daily, each of which includes a serving of meat, fish, poultry, eggs, or cheese. Okay? And you must eat breakfast. Number 2, limited intake of sugar. Strictly limited, including fruits. C, strictly avoid juice and other sweetened beverages. And number 4, letter D, strictly avoid polyunsaturated oils like salad dressings, mayonnaise, margarine, food containing vegetable oils or cooked in vegetable oils. Stay away from those things. So, if that's true, then what causes heart attacks and strokes? Cholesterol is not the villain we've been led to believe. Considering heart disease will claim the life of 1 out of 2 people, it is about time, that you learn the real causes of heart attacks and strokes. So what are they? We already talked about it. It's high triglycerides. It's low HDL cholesterol, the good cholesterol. It is dietary deficiency of saturated fats and cholesterol. Not enough of them. Excess dietary polyunsaturated fats. These are the corn oils, the soybean oils, sunflower and safflower oils. Excess carbohydrates in your diet, particularly fructose sugar. Thyroid that's not working good. Too much estrogen in the body. Not enough testosterone in the body. Too many catecholamines, which are epinephrine and norepinephrine. These things are what ultimately is what causes heart attacks. Too much cortisol from the adrenal glands, too much insulin, and so on. And we can go on and on and on. Oxidative stress to the heart and arteries, free radical damage, too much constricting of your blood vessels, a magnesium deficiency, too much calcium, pushing magnesium out of the system, trace mineral deficiencies. See, folks, there's a whole bunch of stuff that leads to heart attacks, and this is why you suffer from this complex web of physiologic dysfunction. And in order to get this figured out, you have to have somebody that's going to look at these things, who's going to look at this web of physiologic dysfunction, who's going to look at your brain. Is the brain working good? Are the frontal lobes working the way they're supposed to? Do you have good organization and planning? What about your temporal lobe? Are you able to have good short-term memory? Is your sleep good? Do you have a hard time falling asleep or staying asleep? That could be your temporal lobe. Do you feel things that aren't really there? And that's your parietal lobe. You feel like you've got restless legs. These are parts of the brain that must be examined because they control your heart and every other organ. You also need to look at the colon. You need to look at your digestive system. You need to look at multiple organ systems in order to figure out what is the cause of the heart disease. Now, I've just gone through some of the facts and figures here with you about the truth about cholesterol. What I want to do now is to go through some other things, this web of physiologic dysfunction. I talked about the brain. What type of brain problem do you have? This has to be looked at. Which parts of the brain are working good and which aren't? And so on your piece of paper, in the middle you've written heart disease. I want you to draw a brain up to the right and link an arrow there. Because if you have, in order to maximize your health and get you better, you have to fix your brain. Alright? You need a complete exam. How about the colon? This is your digestive system. Do you have constipation or diarrhea or alternating? These are part colon problems. How many doctors have you been to that have addressed your brain problem and your colon problem? You have heart disease, they probably always just look at your heart. You have to look at the colon. If you have heart disease that's being caused by a brain problem and a colon problem, what do you think your results are going to be? Not so good. What's next? We look at the stomach. Right? Do you get belching, burping, bloating? You have a sense of fullness after meals. Do you have to take antacids? Do you have to take Prilosec or Tums? You get a burning up in here. These are signs of a stomach problem. And you can't just continue to take a Prilosec or the purple pill or Tums without addressing the cause of it if you don't go after the stomach. How many doctors have you been to that have actually addressed your brain, your colon, your stomach in relation to your heart disease? If you don't fix these things, your heart will never get better. How about your small intestine? This is so important. This is where 90% of your food is broken down and it's assimilated and brought into your body. That's where you get your nutrients. And food is your fuel source for healing. If your small intestine isn't working good, how can your heart work good? It just can't. This is why you suffer from a web of dysfunction. Now what we can do here is we can link these three, the colon, the stomach, and the small intestine, and you should draw a little line around them, and we're going to call that the gut. Now this is what's so important. Your gut is critical because this is where 80% of your immune system is located in your gut. We find that many of the heart issues that people come in with are actually suffering from an under-the-radar infection in their heart. And it starts in the gut because the immune system is there. 90% of your serotonin is made in your gut. That's why we call this the gut-brain connection. And you should go ahead and draw a line between the brain and the gut. And this is a picture that links it. The brain, the gut, the nervous system. Your gut has its own nervous system called the enteric nervous system. And that's where there's more nerves there than there is in the brain. Okay, if this isn't looked at, how in the world are you going to get better? And if you have a bad gut, you have a bad brain, and vice versa. How well is your gut and your body and your brain going to heal and your heart going to heal when 80% of your immune system is in your gut and you've got a gut that's not working well? How in the world? Not going to happen. You're going to continue with this heart disease. Okay? Some of the things that can lead to this gut problem, this what we call leaky gut syndrome, are foods like gluten, dairy, soy, eggs. It could be gut infections from parasites and bacteria. Okay? These are times when a person would need to have a stool test run to find out if they've got a gut problem, gut infection. The next thing you have to look at is blood sugar levels. Okay? Blood sugar. Your blood sugar should be between 85 and 99. If it's too high or 99 and too low, you've got a blood sugar control problem. It's the number one stressor on the body. If the blood sugar is not stabilized between 85 and 99, then you will have surges of insulin, which is highly inflammatory, and that itself can lead to some heart problems. You've got to look at blood sugar. Okay? Most people, their blood sugar is going up and down all day long. It's called dysglycemia. Surge of sugar because of what you ate, followed by a surge of insulin, followed by a crash. You get fatigued after meals. You get irritable or lightheaded if you miss a meal. These are blood sugar control problems, folks, and if we don't fix those, you're never going to be able to fix your heart issue. You need proper testing. You've got to have the right tests run. Most doctors only run glucose. We run LDH, HbA1c. We want a full lipid panel because we want to know what's happening with blood sugar. The next thing we want to talk about here are the adrenal glands. The adrenal glands are small, but they're powerhouses. They sit on top of your kidneys. They release two main things. They release a lot of different hormones, but the main things I want to talk about are cortisol and epinephrine. Now, cortisol is really important because it's your fight or flight hormone. And when you step off a curb and you're about to get hit by a bus, okay, what happens is cortisol and epinephrine get flooded into your system so that you can run out of the way. If that doesn't happen, what's going to happen to you is you're going to get flattened by the bus. So cortisol. Now, cortisol is really important. It's meant for short-term survival, but if it's left in the system over and over and over, it affects the part of the brain of the temporal lobe where you have short-term memory. And you'll develop short-term memory issues, and you'll need to tie a string around your finger just to remember where you parked your car, right? The other thing is epinephrine. Epinephrine is released, that's like adrenaline. And when it's released over and over and over chronically, when it shouldn't be, it bathes pain fibers. So this is somebody who's got chronic pain syndrome. So if you have a heart issue, okay, and you've got chronic pain as well, you've got joint pain or muscle pain all over, there's a good chance that you've got an adrenal gland problem with it. Okay? How many doctors have you been to who have looked at this stuff? I mean, my goodness, you go in and all they've done is look at your heart. You've got to have this stuff evaluated. You need proper testing, and we do saliva testing for these things. Now, the next section we want to look at here is your thyroid. This is so important because every cell in your body has receptors on the surface for thyroid hormone. And when thyroid hormone is not released in the right amounts at the right times, then what happens is the thyroid, your metabolism goes way down. Okay, metabolism is what drives and fuels the cell so that you can feel good about yourself, so that you can lose weight, so that your hair will stay in and not fall out, so your skin won't be dry, so your digestive system works good. If you have low functioning thyroid on top of a heart issue, which we find a lot with people, now you've got a double whammy. And yet, how many doctors are looking at your thyroid? Most of the doctors out there are only running one test called TSH. And without looking at a full thyroid panel, okay, complete thyroid panel like we do in the office, there's no way we're really going to know what's happening with your thyroid. And if you want to know more about thyroid, you can watch another video we put together just about thyroid. Okay, so if you've got a brain problem, right, and you've got a colon problem, and you've got a stomach problem, and you've got a small intestine problem, and you've got a gut problem of some kind, and on top of it you've got an adrenal problem, okay, and you have heart disease, you have what's called a web of physiologic dysfunction. They go together, and this is where you need to do something about it. Now, you've sat here for the last 20 minutes and you've been watching this video and I've been throwing things at you, and you can take this information and you can just walk away, but I'm telling you right now that knowledge without action is useless. Alright? You need to act. What do you need to do to act? Well, you're going to go in and you're going to say to somebody, unlock me, doc, figure out my combination, untangle my web. But I'm here to tell you right now that you cannot poison your way back to health. You can't do it with drugs. It will not work. It will not fix your heart disease. It will not fix diabetes, thyroid issues. It won't fix anything. It'll mask your symptoms while you continue the downward spiral in your health. That's the way American medicine works, unfortunately. Instead, why don't we find the cause here, pull the cause out by the root so that it can't grow back. So, how in the world would we help you with your heart disease? Well, number one, there's no magic pill. There's no magic bullet, okay? You can't just give a magic bullet and try to fix it, like I said already. We need to find, through lab tests, the antigens or the cause of why it's not working right. Okay, we also need to remove the cause somehow. Through specific dietary changes, we need to repair the damaged tissue with specific nutritional supplements. We need to balance your immune system with specific nutrients and vitamins to help your immune system work good. We need to find, through neurologic testing, the imbalances in the two sides of your brain, if they're there. We need to improve your brain function using oxygen, using brain-based therapies. So here we are right now. You've got two choices here. You get to be broken and have heart issues, or you get to get unlocked. Your web gets to be untangled. And that's the choice you have to make right now. And so I hope and pray that you would actually do this. Your first action step would be to set an appointment. The way you do that, you simply call our office. The number is 952-949-0676. You call our office. What's going to happen if you come into our office? Well, on the first visit, we're going to do a complete neurologic evaluation. We're going to do a complete metabolic evaluation. We're going to review any existing labs you have. We're going to review your metabolic and your neurotransmitter assessment forms. It's a good idea to bring your spouse. Okay? On the second visit, we're going to review the exam and go through what we found with you. We're going to go through our findings. We're going to tell you if we accept your case or not. And if we accept your case, we're going to go through any further testing that needs to be done. We're going to tell you the different options you have. We're going to go through whatever the finances are. Your spouse must be here for that. So that's your first option, or your first step. Now here's the thing. Even if you're on the right track, you'll get run over if you just sit there. You're just going to get run over. Please don't sit there. Please decide to pick up the phone and call, because we can help you. We can help you with heart disease. We can help you untangle your web of physiologic dysfunction. If not now, when are you going to do it? 3 years? 5 years? 10 years? Call our office, 952-949-0676. I'm confident that we can help you and get you going in the right direction. All right, thank you so much for watching. Hope you have a great day. God bless you.